I have here to interview with me for the healthcare professionals interview assignment Miss Donna Scott, the nurse manager here at Bentab Hospital in the clinic.
I did. My grandmother used to work at a hospital when I was growing up, and we used to go up to the hospital and just to visit her and to see her. And I think I was just kind of I guess at a state of kind of admiring nurses at that time, and I kind of saw what they did a little bit, and I guess as a child I kind of thought, oh, I think I want to be a nurse, when I grow up one day. And I think they just kind of stick with me, it stayed with me. So as growing up, it was just kind of a dream of mine, just to become a nurse. And then I had a cousin also who was a little bit older than me, who also became a nurse. So I guess that kind of continued with my inspiration. And I always said, I guess, growing up, I enjoyed, helping people and, talking with people, and I guess doing kind deeds. We took speech. Usually about maybe 45 to 46 maybe. And they may vary, 40 to 46. Well, there's always a lot of changes, I guess. Policies, evaluations have to be done. And we have to do a lot of working with the patients. Sometimes there are complaints or conflicts and things of that nature, so you have to address those issues. You have to do corrective actions, when there are fallouts in different areas. With Joint Commission, we have to make sure that we're always ready for any time there's a survey coming up. And then we have people who go around to do these readiness rounds. So you need to make sure that your staff is informed and know what these different standards are, because someone can come by and just ask certain questions, and if your staff don't know the answer, that means that you need to follow up. You need to make sure that they know it. Otherwise, you get a bad score, right? So you need to follow with your staff, especially if there are things that you need to have corrective action plans for, to make sure that that everyone knows what they need to know in the event they come back again. So, and then working with the different personalities, you have to know how to work with them. You have to keep up with a lot of different things, time and attendance. You have to, counsel employees. You need to, work together as a team to make sure that you are improving in areas that are not in compliance, or like patient satisfaction for one. You want to make sure that your patients are satisfied, because you want your patients to come back, right? You don't want to get a bad name. You want to make sure that you are providing service first care to your patients, that all the staff members are friendly with your patients. You want to try to get your patients in and out. You want to decrease the length of stay that they're here. So it's just so many different things that you have to look at. I think being a manager, and you have to be accountable for lots of different things. It's a big responsibility being a nurse, and there are a lot of things I think that can be stressful for nursing. Well, the performance appraisal is changing here in Harris Health, and as you all know, we've changed our name too. I don't know if you knew that or not, but we used to be called Harris County Hospital District, but now we've changed our name. We're Harris Health System, because we're just not Bentab, LBJ, Quinn Mason, all that. So with all that being said, we're also trying to move towards magnet status. So some of the roles have changed in responsibility for the nurse, where the nurses they are required to be more involved with their whole community of practice in the area that they're working in, and looking more at clinical inquiry, where you're looking at evidence-based practices to try to make sure that we're doing things based on what has been researched and say is best for the patient at that particular time, where the patient will have the best outcome. And is the nurse involved with being collaborative and working with other team members in trying to make sure that we are doing best practices and collaborating even with other disciplines. So nursing needs to be involved like in all over the organization, not just in nursing. Like nursing needs to have something to say, if there's a meeting with pharmacy, OT, or if it's administration, nursing has to be represented in all of those different areas instead of just, just one. So we're looking at, nursing clinical inquiry. We're looking at quality And quality is another area. It's about 7 different areas, and it's something new. The new appraisal, we need to make sure the nurses, we're looking at the clinical care performance standards. We're looking at their quality and safety performance standards. We're looking at clinical inquiry performance, communication and collaboration, and we're looking at resources and system utilization, and then the role of a professional nurse and their responsibility. So there are lots of requirements for the nurse, and with this being said, there's like, we have to do a portfolio to identify that we are meeting those standards. So that's a little stressful, I think, for the new nurses too, for the nurses now, because that's something new that they haven't been doing. So you have to really show evidence that you are doing all these different things, and then their evidence, some of them has to be clinical wise evident in the medical records. So you have to be able to go back and see that, oh, well, yeah, the nurse said that she did this, so you have evidence to support it, because you can see that it's in the record that they actually did it, versus just doing and saying, okay, well, I did 2 in-services. I have some autonomy, you know, and I do like, I kind of like what I do. The only thing is just the negative piece. I like working with people, you know, educating them. I guess I do a lot of writing too, and to update individuals on things that they need to know. And special projects, we get to do that, you know, working in this position. Whenever there's anything new, I mean, usually there's some involvement. Sometimes, you know, it can be fun too, you know, when you get together at your leadership meetings or your monthly meetings, or during the different holidays, we may do something special for the staff, you know, put on a skit or something, something fun. What else? I mean, it's just rewarding, especially when you talk to patients too, and you know that you made a difference, you know, for them, and they're grateful. Like if you just make them an appointment, you know, they're happy. Oh, thank you for helping me. They really are sincere, you know, when they, you know, when they're grateful for whatever you do to help them. Even if they have to wait sometime, you know, some of them, you know, they really don't mind. And you apologize for the wait, and they're like, oh, it's okay. Oh, communication is very important, because if you don't communicate, you know, things kind of just happen haphazardly, right? You have to make sure you communicate things that are clear and specific to what it is that needs to be done, because if you leave something out, you know, that's when you're going to have, you know, a bad outcome. And with communication, or the lack thereof, that's usually the cause of any adverse event, if you leave something out of the whole process of saying, okay, well, for example, you say, okay, well, that patient is O positive, you know, and you leave that out, that could be critical, right? The patient gets the wrong blood, or if you don't do a timeout, you know, when you're doing surgery, you know, okay, it says left, okay, but you actually going to say right, and then what happens if you take the wrong whatever, take the wrong limb out. So that's why communication is very important. I do a lot of emails. I know I do a lot of emails. But, you know, sometimes that's really not enough. Because they might not read their emails and say, I didn't get it, because it's a lot of information that's given from everywhere, not just from me to the staff. We get communication from corporate communication, right? They get emails from me, and they may get, I mean, it's just, they get emails probably from everywhere. You know, different departments may send them an email. So you have to make sure you try to address those in your staff meeting. And then sometimes you may have to do it one-on-one. You may have to post some things like our patient satisfaction scores. We post them in the lounge, in their break room. So my phone, they can call me on my phone. You know, they have my office number. They have my pager number. So there's always a means of communicating. You know, we have a team leader, and I have a charge nurse that I can also communicate to. So I try to use them as well to help with communicating information to the different teams that we have in the clinic. Oh, of course. I think a lot of people may have a misconception about nursing. Maybe, I may not. I mean, some people may think that nursing is just bedside nursing, which is not really the case, because nurses can do a gamut of different things. Nurses can be, you know, nurse practitioners, as you probably know. Nurses can also give anesthesia in the OR. Those anesthesia nurses. Nurses, if they're nurse practitioners, they can specialize in other areas, family medicine, cardiology, or OB, or med surge, or even critical, working in the EC, emergency medicine. So they can work in all those different areas, and they can write prescriptions just like physicians working under a physician as a nurse practitioner. They could be professors. They can work in quality. They can work with lawyers, expert witnesses, OR, all the different areas for nursing, OB, medicine, psychiatric, nursing, home health, quality. They can work at an insurance company. So nurses can do just so many different things. They become nurses. Some of them become lawyers. So, and it's just wide open that what nurses actually really can do.